trials and tribulations strengthen a man, but with women, they weaken and cause personality disorders. So borderline personality disorders are a legacy of childhood trauma in many, many instances. So you want less trauma, the least trauma, the better.
Sorry, just so I understand you, because this is a subject I am very interested in now. Yeah. So what you're saying is, okay. So ultimately, in any relationship, especially one of marriage, that is something to gauge for, is the trauma.
Yeah.
How that trauma got there. Obviously, you gauge with the relationships she's grown up with.
Yeah.
But you're gauging for trauma because it's a trauma that then feeds into the personality disorder. Yeah?
Absolutely.
Okay, sorry, carry on.
Yeah. So something called borderline personality disorder. Okay. And that's a whole new kind of worms. Okay. BPSD. So in that, you can narcissistic personality disorder as well. A narcissistic personality disorder. And it happens in a lot of women where they avoid accountability. And that is a very big red flag. If a woman's avoiding accountability...
Okay, Asif, yeah, just what is, I don't want to miss any of this, right? So let's go back to this. So, okay, the NPD, the narcissistic personality disorder, is the more extreme version of the personality disorder.
Yeah.
So let's start in systematic order with this here. I want to try and cover everything on this. So start with the borderline personality disorder, how that happens, what that looks like, how does it play out in a relationship and a marriage, and what to look out for, how that borderline personality disorder, where's the boundary line between the borderline to narcissistic personality disorder. So I want to try and cover this in detail and depth if we can today, more than anything, please.
There's two keywords here, or two keywords. First is disorder. So it's a disorder. So it's not normal. So let's stop glorifying it. You see in the media, people saying, oh, I've got BPD, but it's fine, I'm normal. No, the word is disorder. Like, it's like diabetes. It's a dysregulation of insulin.
So it's not something that's good.
Yeah, exactly.
Exactly. So it's not something to be ashamed of.
Exactly. It's nothing to be ashamed of. It's like diabetes. It's a, dysregulation of your insulin. Same as borderline personality disorder. It's a dysregulation in your emotional attachment styles, your neurochemical cascades that determine your relationships. You get love flooding.
How you decipher your emotions and communication is a disorder in that.
Absolutely.
Just from a layman's perspective now, I say something to you that is very normal, but the way you perceive that information, process it, and then understand what it is emotionally is a completely different story.
Absolutely. And the other key word is borderline. So this is borderline. It's not overt. And people often get married and they have...
It's covert.
Yes, exactly.
It's covert. So just to clarify, borderline personality disorder is normally covert.
Yeah, exactly. It's covert. It's borderline, as in it's not overt, and
it's not fully fledged. It's just they might get some things right, but so let's say it's 50-50. They might understand 50% of the information, but the other 50% turns into this dysregulation bit of the brain.
Absolutely,
and it's a fantasy that you don't know.
Exactly. So you get limbic hijacking. So the limbic nervous system, which is right at the back of the brain here. So the limbic nervous system gets hijacked. You got the cortex, the frontal. I don't want to bore you guys with anatomy.
No, it's fine. Prefrontal cortex. I understand. I love it.
The prefrontal cortex is executive functioning. That causes the rational decisions. The limbic system, particularly the basal ganglia. Now that's the hijacking part. That's where emotional hijacking occurs. And when BPD, emotional hijacking is much more common. It's a much more common occurrence. Emotional hijacking is where you get extreme love, or extreme jealousy, or extreme anger.
Yes, okay.
So it's just hijacking. It's not regulated. You get flooding.
Yeah, so their brain can't regulate the information to the emotion.
Exactly. Whereas ADHD, for instance, a neuroatypical disorder, if you like to use that word, neurodivergence, ADHD is the inability to regulate focus. Okay?
Right, yes.
It's to do with dopamine, etc. Because dopamine is the reward of motivation.
Yes.
You keep motivated.
Yeah.
Whereas with borderline personality disorder, it's a dysregulation of things like dopamine is one of them. So dopamine as well. You've got noradrenaline there. You've got serotonin, which is happy hormone. So oxytocin, which is the connection hormone. A lot of these hormones are either underfired or overfired.
Okay, so does the individual with the personality disorder know that they have a disorder?
They don't.
So they're complete. Okay, so this is what we need to get to now, yeah? To the individual, they have no knowledge of their, to them, it's just how they process information and this situation. So basically, if we had a normal conversation, you overreact emotionally and aggressively. I'm thinking, like, what's up with this guy? It was a normal question. You're genuinely think, like, he's disrespected me.
Exactly.
You genuinely believe that happened, and you have no control over it.
You have no control over it, but you can have metacognition. Metacognition is having metacognition is a term where you rise above your head. You become like a ghost and say, you know what? Objectively, you said, I'm behaving unreasonably here.
Yeah, but can they, okay. That is possible even with the disorder.
They
can do that.
So, no, they can't do that. But what I'm saying is you need to have guardrails in place, family, friends, you're not behaving reasonably. Think with a lot of BPD women, they get reinforced by their friends and family.
Okay, if we take this BPD into, I think, because there's a lot of brothers, I'm sure a lot of fathers you speak to as well, it turns out there's a lot of sisters suffering, especially from our community, with this sort of BPD.
It's very common.
Like you said, you've gone into a very in-depth analysis of what it is. So and this is good for people to understand now, yeah? When you're in these marriages as the husband, you don't understand. You're trying to make sense of it yourself, yeah? And as I've said, you're not really qualified to deal with that, yeah? But we put some... we put some meat on the bones of around what this issue is, because this is what is coming through in the community. And what happens is, from the South Asian community, especially maybe the Muslim community, the perpetrators' friends and family, especially their parents, brothers and sisters, you know the South Asian position, you just cover up for your own regardless, which is then feeding into the disorder more indirectly, because they genuinely then believe that these scenarios are happening when they're not.
Normalizing the abnormal and making
that it's the other guy's fault.
Yeah, exactly.
He's just a bad guy.
Exactly. So one of the biggest telltale signs of BPD is fairy tale narratives. Just making up these schemes in your mind and coming into marriage knowing how it's going to be based on a Bollywood drama, based on some kind of Indian TV drama. You've already decided in your mind how the mother-in-law is going to be. And because there's a reality expectation mismatch, you then concoct that drama to make up for that mismatch. Because she could be the nicest mother-in-law in the world, but there's a mismatch there between your expectation and reality. Therefore, then you distort reality. That's what BPD comes with. You distort reality.
Yes, right. Everyone just take note of this. I think we'll stay on this because there's many people suffering with partners who are going through this. So I think this is a very important subject. So people take note. We're going to dive deeper and deeper into this. So just to elaborate on what you've just said. So they come into these marriages. So let's say some girl has come into a marriage, right? She has got some trauma that has taken place in her life in one form or another, cultural trauma, generational trauma. Her dad was just an angry man, or mum was really slaving her whole life in the kid. Whatever these things are, let's just label them as trauma, And we apply these to sisters because, like you said, for brothers, generally trauma is good. For men deal with it differently, it doesn't play out in this way. So this trauma is manifesting into their upbringing,
their nervous system. Their nervous system gets dysregulated. For a man, nervous system gets strengthened. So his nervous system gets reinforced. Just like the muscles. You work out, muscles get reinforced. In a woman, though, the neuroplasticity then causes more hijacking. You don't want her to be constantly under stress and trauma. You don't want that. Because this directly causes personality disorders. Schizophrenia is an extreme example. It's again trauma related as well, and they say a big reason why the Afro-Caribbean population had a bigger risk of schizophrenia was the trauma of migration. Trauma of migration to the UK, the Windrush generation, trauma of migration. That's one of the people like to say, oh, it's cannabis use, etc., it's poverty. But why the Afro-Caribbean, particularly the West Indian community, had a high rate of schizophrenia in Notting Hill, in Birmingham, and they say it was a trauma of migration during that particular period. So it's trauma. Trauma causes extreme manifestation in the brain. But borderline is so subtle to pick up.
Yeah, that's what I'm saying. Okay. So, all right. So let me put it another way. Yeah, we're saying the individual suffering doesn't know themselves.
Yeah, they don't know.
But then with the borderline, okay, we're talking about, just to be clear, borderline personality disorder. But I've seen people with this sort of behavior, yeah, in depth, yeah, borderline personality disorder, let's call it, yeah. Now, you're saying they can't regulate their emotions, hence they can't regulate a social situation or scenario, or let alone in-laws and dealing with the other generals in the family. That's a whole different beast. Yeah. But let's just take that. But why is it then, in some cases of borderline personality disorder, in front of the right person, they appear to be the sweetest. They can be nice when they want.
Yeah.
They can decipher a conversation because they've labeled someone as a friend. Hence, they can never interpret what that person is saying. They only seem to relate it to, say, the relationship or the in-laws. Because this is when that borderline personality, the deregulation is selective in who they're dealing with. Is that part of the disorder, or is that their personality?
Yeah, so it's part of the disorder, because what happens really, this is why recognizing and vetting women with BPD is very important from the outset, because you don't want to get into, you can't fix it in a marriage.
No. Okay, just to clarify, so all those men that are in these relationships, or they find themselves with these sort of individual, and you start questioning your own sanity.
It's not you.
It's not you. Yeah. And it's not your fault, and you were never qualified to deal with this.
Exactly.
So do not feel bad about it. You haven't failed. Yeah.
No, exactly. It's just slipped under the radar, and you end up in a marriage.
They didn't know. They just presumed this person was.
You can't pick up something you don't know. If you're not looking for it, you can't pick it up.
But like you said, borderline is subtle. But before we go into the vetting, let's carry on with this. We'll do the vetting at the end. Yeah. So move on from the borderline. I mean, is there any more you want to say about the borderline element before we move on to the narcissistic element?
No, that's it. That's it. Yeah.
Okay, so we understand now what that borderline personality disorder is, how it manifests, and how it can play out in a relationship, or to be fair, in any relationship with someone like that. And it's borderline, so you can't always tell.
Yeah.
So let's go into the more extreme borderline personality disorder, which would be the narcissistic personality disorder. Give us the difference between the first and the second.
Yeah. So borderline essentially is much harder to spot. It can be selective, whereas narcissistic is prevalent in most situations. It's all about me.
So that applies. So the narcissistic one, will it be? They are going to be the main star. In
they're the star of the show. It's all up. So what is narcissism? So if you look at the Greek mythology, Narcissus was a good-looking guy who fell in love with his own reflection in the mirror. In the water. He went to a lake, and he started looking at his own reflection. And I think the story goes, he stood there for so long, he became a stone or something. I'm not sure what happened. But he fell in love with this. He thought this was a handsome guy in the water. And he fell in love. But he actually turned out to be his own reflection. So the whole concept of narcissism is falling in love with yourself.
Right.
There's something called self-love, which is good. But then falling in love with yourself and thinking you are the most beautiful, perfect thing in the world. And being then obsessed with yourself. Because he was obsessed with himself. He literally stood there for years.
So is that like looking at yourself as a third person? And
yes.
Think, wow, you're so good. Like,
Yeah, it's also third person as well, but it's the lack of self-awareness that there's other things around. So he had a lack of self-awareness. He looked at the thing, he had no self-awareness that this is only a reflection. This is only a reflection. He thought this is genuinely another person. With narcissistic personality disorder, they have no self-awareness that the whole world sees them as narcissistic. They have no self-awareness. So when they bring things to themselves, like victimhood,
right? Okay.
When they bring things to themselves, particularly, I'll say this with capital V, victimhood. This happens in a lot of females.
Yeah.
They bring it on themselves. I am the victim, even though they could be the oppressor. They will sometimes say, "Oh, but what about me? What about me? What about me?" But we're not talking.
Right, apologies for that. We got cut off. We were talking about narcissistic personality disorder and the borderline personality disorder. Dr. Asif has a lot of insight into all of this. Sorry, it's not Asif, is it?
It's Asif.
It is Asif, isn't it? I thought it was Arif. I thought, bloody hell, I've messed it up. Yeah, he has a lot of insight and a lot of knowledge. So we're going to make the most of the time we have left, and we're going to try and put some knowledge and information around all of this. So Dr. Asif, carry on with the narcissistic personality disorder, the Greek mythology, as you said, the guy fell in love with himself, became stoned.
Yeah.
You sort of on that, and how the narcissist perceives themselves to be the victim in their story, no matter what the scenario.
Cool. So we call it narc. It's just a smaller term for narcissistic personality disorder. The other side of that is hyper empaths, so people who are empath. So having a bit of empathy, or empathy generally, is good. Having self-love is good, but you don't want to go in the extreme sides. So hyper empathy, where you literally play out other people's emotions.
So okay, so what's that the opposite of the narc?
Yes, so you got narc there, narcissistic personality disorder, and then you got extreme and hyper empathy.
Is that like a people pleaser?
Yeah, exactly.
Right.
So you've got two ends of the spectrum. We should be balanced. So we should be in the middle. Some self-love, boundaries, assertiveness, but not narcissistic personality disorder. We should be empathic. We should be caring and reasonable with other people and tolerant, but we should not be walkovers and doormats. The hyper-empathic person. So you got the empath and you got the narc. These are the personality disorders which usually present with, aside from BPD, but the narc one is much more common. Narcissistic personality disorder is much more common, and it's much more detrimental to other people around you. The hyper empathy one, the empath,
You just take on other people's problems.
yeah, exactly. Yeah. You kind of ruin your own life
by taking on other people's trauma.
You don't really outwardly manifest, whereas the narcissist will outwardly manifest their own insecurities, to their own trauma to other people.
Yes. Okay.
So with narcissistic personality disorder, we've got a very bad conception in society. We think only men are narcissists. We look at Donald Trump. Oh, he's so bombastic. He's got such bravado. Actually, it affects women 60 to 70% times compared to men.
Okay, right. Hold on, doctor. 1 second. Right. You said the opposite. So you got the narc and you got the empath. Yeah.
Yeah.
So you said you have to find a balance, but the individual themselves who's on either side of that extreme, they can't control it. They're dysregulated.
Yeah, they're dysregulated.
So they don't have a choice in that, do they?
No. They don't have a choice in that. But they do have a choice to seek therapy. They do have a choice.
Oh, but they can only seek therapy once they realize they have a problem. But if they don't actually believe they have a problem, they believe they're just a victim of circumstance.
Yeah, no, exactly. Yeah.
So what can cause them to have that moment and think, wow, there's something wrong with me? Like, what do we do?
Every single narcissistic person I've come across, and usually females, after they've had therapy, they said, you know what? I was that person and I was wrong, and they have insight. However, going back to your question, how to get to that stage? How to get to that stage is, reinforcement from people around you. Like, are they saying just something not right with you? Are you the common denominator in all the breakdown of friendships, breakdown of relationships? Are you the common denominator? It's only happening to you, and you're the common person. If that happens, you're like, wait a second, I might be the person that's causing it, not the victim here.
Okay, so ideally, let's put it to what is affecting a lot of fathers that we speak to, and because they're dealing with, unfortunately, a lot of women who are suffering from this, yeah? So ultimately, these women, when they say listen to, they won't listen to the husband or his side of the family, because they are used as, in this drama, they are used as these evil people that are making her a victim, yeah? So ultimately, it comes down to the person with the disorder. The husband is, again, he's the one that's making her a victim. So it'll have to be from her mum, dad, brother, or sister.
Yeah, from her side,
They need to come forward to help her.
But they won't. Again, princess complex. She's right. She's beautiful. She's right. She's princess. I know girls who are 3 out of 10, and their parents think they're 10 out of 10s. They physically can't even, correlate. They physically can't correlate what she's like. Never mind emotionally.
Okay, so while we're on the subject, so any brothers out there, so this message, let's make this message now specifically for brothers, because like I said, these sisters, especially they're from our community, they are our people.
They're everywhere.
So I've got sisters, I'm sure you've got sisters, cousin sisters, extended sisters, you know, people that, you know, in the mosque, they've got sisters and daughters. So what message will we put to brothers and fathers and uncles in the community to look out for this, or to say, listen, we know they're your blood relative, but we don't want these sisters to get divorced. We don't want them to suffer, and we want to help them. So what can they look out for or do to think, is my daughter or sister lying, or is she suffering from this BPD or NC?
Right, okay. I always believe in prevention is better than cure, and that's always been my mantra in medicine as well. I'll rather make someone not develop diabetes when he is pre-diabetic than to treat the diabetes when he gets it. So I believe in prevention is better than cure, and I use that same framework in coaching. So when it comes to personality disorders, okay, I don't believe any brother should marry a woman with BPD unless she agrees to premarital therapy.
Right.
Okay? No. I'm not discounting the sisters that have it, because up to 40% of women in our community will have it, by the way. Okay? 40% of women will have it.
I very much believe that.
So 40% of women will have it. We're very good at saying, oh, she's medically fit, blah, blah, blah. She's not got diabetes or thyroid or polycystic ovarian syndrome, etc.
It's him, yeah. Or blame the other guy.
Yeah, exactly. But what about her mental health? That's very important. So I would say, okay, and how do you uncover BPD? Well, you want a doctor, you want a psychotherapist. When you vet, ask about trauma, particularly trauma, male-related trauma. Father leaving, father abusing, physically abusing, sometimes sexually abusing even, na'uzubillah, but yeah, it does happen. Ask about abuse, particularly male abuse in that family. Uncles, fathers, stepbrothers, etc. Ask about abuse, because that is a good indicator. It predisposes her. Like I say, it doesn't always lead. 40% on chance, but it doesn't. More than half the cases, it doesn't lead. So it does predispose her to having borderline personality disorder and learned victimhood. Learned victimhood. Okay. Yeah, learned victimhood. Because she's a victim in her younger years. She was, whatever happened to her, trauma, she's a victim. So she takes on that personality as, I am a victim now as well.
Yes.
As a fully grown woman. And she'll play out these scenarios.
Where she's a victim. She'll play out a scenario where somehow she was the victim, or she's the oppressed one, or she's had it hard or difficult. And if a situation goes wrong, there's no accountability.
This is the thing.
His fault or her fault, or your house is your house and your house ain't big enough. Or it doesn't matter, it was your mum and dad, even though you were living separately.
Exactly.
Scenario will be made to suit.
It's all about me. Like, for instance, husband comes home from work. You know what? Today's been horrible. I've done 12 hours. But I had a hard day as well. The response would be, I've had a hard day as well. Just validate his feelings first. He's had a hard day, and you've had an equally hard day, but he's not talking about you, he's talking about him. It's like saying, oh, by the way, Spain is a hot country. Yeah, but Greece is also hot as well. But we're not talking about Spain, Greece.
But this is what I'm talking about. It's a ridiculous. For those who have never dealt with, because this is what I've said, right? Yeah, and go back to vetting in the community. Yeah. Until you get married and you say end up with someone with BPD, if you came across someone like this in any other realm of your life, what happens is you don't get any experience, because you'll be like, he's a bit funny, or she's a bit funny,
she's a bit
I'll
odd.
avoid them. So you avoid them, so you never fully understand. When you end up married to someone like that, you are way out your depth, and there is no consistent or meaningful conversation, because everything's a counter-argument to some scenario that doesn't exist.
Everything is a counter-argument, and the same condition could reproduce a different result. So flowers or chocolate could produce tears of happiness. The same flowers and chocolate could produce tears of sadness, because why did you get me the same flowers again? So there's no consistency, and you can't be working on eggshells.
That's exactly it. But this is what I'm saying. For those that are experiencing it, they don't know what's going on. They don't know if they're gone mad, if they've got mental health issue, or it's the other person, because it affects the person dealing with an individual like this on a daily basis. It affects, I think, their mental health as well. They start questioning their own sanity.
Of course.
And like you said about the flowers and the chocolates, if her brother did that say, scenario with the flower and the chocolates, it will be ecstatically happy.
100%.
If you do the same thing with the flower and chocolates, it will be somehow turned into how you did something wrong.
Exactly. And something good for your mother or sister could then be turned against, you didn't do the same thing for me.
Yes.
And yeah, it applies both ways as well. With the mother, if you do something good for the wife, the mother will say, you didn't do the same thing for me. Instead of appreciating the act for the other person, they bring it back to their own scenario. It's me. It's like, it gets even to the extent like the mother gets jealous of you marrying the wife. Why do you marry her, not marry me? Like, it gets to that, you know what I mean? Like, conceptually. It's so illogical, it's so irrational, does not make any sense at all. And it's a lot of brothers, like, you can't change your parents or your sister, you can't change. So if it's in your auntie or your sister or your mother, you can't change them, you have to live with it. But when it comes to marriage, you can vet and you can choose the right partner. Marriage is in your hands and you have to choose diligently, sensibly, with the right lens. You've got to view women with the right lens.
Okay, Dr. Asif, let me ask you a question now, yeah? So going back to what you said earlier about the vetting, as in you check for abuse, historic abuse, what was your relationship with father? Now, my only issue with the vetting process is generally how you've gone for a coffee. So you've met a sister on an app or whatever, you're looking for marriage, both of you are looking for marriage, you go to a coffee shop, you're having a chit chat, messaging back and forth. Would it not be normal for someone, especially I would say the Asian community, to cover up issues in order to get it over the line?
Of course.
So how do you decipher, how do you draw out this information? Because you can't openly ask, was there any history of abuse, physical, sexual, I mean, it's a very difficult conversation, right? Let alone to bring it up with a stranger that you're trying to get to know. It'd be, check please. It'd be like a check please moment.
You'd be phoning the police, man. This guy's a creep.
Yeah, exactly. So how would you even, is there some telltale signs that you can, you told me, how do we get this information out without creating some red flags of your own sort of thing?
The best way is not to rush into marriage. And, brothers, I know some of you got blue balls, but get to the gym, man. Have a purpose in life. Don't think with your private parts. Think with your mind. When you think with your genitals, you will end up marrying red flag women because you will set your bar low. You will think emotionally. So, yeah, have a purpose in life. Get to the gym. Get in shape. Have a purpose. Have a plan. Have a system, have a goal to reach, okay? You have a financial goal, a physical goal, etc., etc., etc. Have a goal. So you don't pedestalize women. When you start pedestalizing women, you will marry women without even asking them the red flag questions.
Because you're just happy to get married.
Yeah, you're happy to release, bro. You're happy to bust a nut halal way.
Man's a man, innit?
Yeah, man's a man.
Right.
Yeah.
Okay, so let's go back to this. Okay, let's just say for argument's sake. So I'm a sister. I met this guy, right? Yeah. And I've got a history of abuse, or my family ain't that great. They're all a bit, whatever. There's been violence, aggressive. They're back home. They're from a village. However you want to perceive it. Yeah. I'm obviously going to try and to give myself a good chance of making this work, especially if I want. I look, for example, let's say for argument's sake, I meet a guy. Yeah. I'm a sister. I met a guy. Let's say he's a doctor. He's a good catch. He's a doctor. He's educated. He's nice looking, whatever. And I'm thinking, right, I'm not going to be forthcoming with this info, am I? Because it's a game. There is an element of everyone's playing a game, yeah?
I don't want to lose him.
Yeah, so she's thinking, I ain't going to tell him that I may have these issues or potential issues. And with these BPD personality, these borderline personality disorders, especially if it's covert, not overt, and the narcissistic personality disorders, which are covert, these people are experts at
concealing
to the point where you can never convince that person that this is a bad person or there's something wrong. They will put,
because the experts are lying. The experts are lying. Yeah.
Say it again.
The experts are lying.
Right.
So especially those that have narcissistic personality disorder, their experts are lying.
Yes, 100%. So okay, let's talk about in that case, right? Yeah. So let's say, okay, vetting prevention is better than cure. Once you end up, let's touch on this for 1 second. If you find yourself, a few weeks, months into your marriage, every scenario is she somehow the victim, the conversation's not flowing, you don't feel like chemistry and click purely because you know there's some emotional irregulation, personality disorder. What would you say to those guys right now? Are they, in my mind, there's nothing you can do to fix it.
No.
You're done.
You can't do anything to fix it. Even as a doctor, I wouldn't fix it myself in that marriage. I would always seek external help. Okay, and external help, you should always, okay, because this is a psychiatric disorder, by the way.
Yes.
Okay, it's psychiatric. It's not spiritual, it's not social, etc. It's psychiatric. You see a qualified psychotherapist or psychiatrist for her treatment. If she had a cold or a cough or pneumonia or diabetes, whatever she had, you'll go see a doctor. You wouldn't fix it just by waiting. Same as a psychiatric condition. If it wasn't fixed in childhood, you should fix it now, if you married her, by the way. However, before you married her and she hasn't fixed it, ask her to get it fixed by therapy. Therapy is 1 session a week or 2 sessions a week, 10, 12 sessions, 2 months, 3 months, you're done. This will save your marriage.
Okay, Dr. Asif, okay, let's put it another way. How do you find yourself there? She believes she's a victim. The world believes she's a victim. You're a monster. You've got kids. You don't want to break up. You understand now she needs some sort of psychiatric help, yeah? But this person, let's say if it's the overt, so they genuinely believe they're the victim, how do you get them? Is there some sort of buzzwords that they can use from a psychiatric term that will trigger certain emotions to say, yeah, you're right, babe, let's go and see this guy? Is there some technique or tactic that you can use because half the problem is convincing them they have a problem and it ain't you, and to convince them, I will help you and let's get you in front of the right person. Is there some advice you can offer for those that are in it, because they don't want to end it, they've got their kids, they're willing to work, try and help this person, they maybe even genuinely love this person regardless of the disorder and what they're suffering through? Any advice for them? Okay,
as a woman, you expect your man to take the lead and be proactive. Okay, this is something you have to be proactive about, not reactive. So say, look, babe, I want us to work. We've got a child or we've got a house together, etc. I want us to work, okay? And I'm concerned about your well-being. And I think this course of therapy helped me in the past, and I think it will help you as well. I have booked us an appointment, or you an appointment, or I've been searching and I found this guy or this girl locally who's got good reviews. I would like you to see him or her, 1 session a week. So just be proactive. When you're being proactive, it comes across less like a dig and more like a therapy.
So this is how I perceive this information now, yeah? Approach it with love and affection.
Yeah, of course.
So be smart, yeah? You have to disguise it with something to bring the...
You've got to pander to their needs.
Yes, that's what I'm saying. So
they're a narcissist.
So give them the attention and love. Yeah. Do it, get them a nice dinner.
Yeah, sit down, exactly.
Have dinner, I'm worried about us. I know someone that can help us and make our relationship stronger. Do it with love and affection.
Yeah, exactly.
If they crave affection and love, give them that.
Love language.
Yes, so give them love language until you get in front of the right person, and hopefully he can navigate it from there, give the proper psychiatric therapy and treatment, and maybe make them realize your relationship will be stronger. But sister, I'd go say one step better, go for a female psychiatrist rather than a male female, and then they can connect with them more and potentially release these negative triggers.
Yeah, exactly.
Because that is the psychological term, if I'm correct.
Yeah.
If you can find these negative triggers and release them, can you then regulate the emotion to the communication conversation better?
Absolutely, because you're getting, Steve Peters calls it hijacking.
Right.
It's a very good book by Professor Steve Peters called The Chimp Paradox. The Chimp Paradox says we have a primitive brain, or we have a human brain. The human brain is the neocortex, the prefrontal cortex, that makes the executive decisions.
The logical decisions.
Logical decisions, yeah.
Prefrontal cortex.
PFC, right at the front there.
Yeah.
And Allah subhanahu wa ta'ala tells us in the Quran, the Nasiya, in Surah Al-Alaq, this is the lying part of the brain. Allah tells us.
Yeah, the lies come from the prefrontal cortex.
Yeah, so Allah tells us in the Quran, where, you know, this is a lying part of the brain. The forebrain is called the forebrain. Allah obviously the creator, the manufacturer.
Yeah.
So he knew this before science did.
Yes, I've read that on that science that about.
Exactly.
The forelocks.
Yeah, the
like
forelock.
Forelocks.
Yeah,
I read that
a sinful forelock, and that's the executive, the PFC we call it. Okay, the neocortex. Neo means new, because they believe in evolution, and this is the new part came from monkeys, whatever.
Right.
But they also believe this is the monkey brain. We don't believe it's the monkey brain. We believe it's just the basic brain.
It's the brain. Yeah.
No, as in the brain stem area.
Yeah.
Just the basal ganglia, the limbic system, emotional regulation.
Right. Okay.
So if with psychotherapy, which is a talking therapy, or rapid eye movement, or REM, we can do that as well. So for symptoms like depersonalization and derealization, these are symptoms you can get with extreme BPD.
Right.
So derealization, you do not think you are here. You think you are a ghost. And depersonalization is you don't think, similar to derealization, but depersonalization, you don't think you're here. Derealization, you don't think the situation is here. As in, it's a different situation. They're the extreme versions.
Yeah.
So depersonalization, derealization, the whole surroundings. So that can be an extreme manifestation of BPD. Because BPD, what is it? It's storytelling.
Yeah, but okay. But the prefrontal cortex, you said, they're good liars.
Good liars.
So how does, if it is it the, because in order to create the lie, yeah, so okay, we've got the back of the brain, as you said, that creates the scenario to think, oh look, he's treating you like this again, you're the victim. But in order to corroborate that story, the lie, when the third person comes in, is made from the prefrontal cortex. So they must have some awareness. Do you know what I'm saying? That you're lying, or is there...
So the awareness comes from the back of the brain, actually. The awareness is from the sensory areas, okay, at the back of the brain. The prefrontal cortex executes the lie. Executes, you know.
Right, okay.
Okay,
right.
but the sensory, the lies are coming in from the ear.
So the lies are from the back, that's just executing.
Yeah. So sensory perceptions are being received at the back of the brain.
Yes.
But the bottom of the brain, the brainstem, the basal ganglia, the limbic system, okay, that's hijacking the whole brain.
Yeah, so basically the whole machine's working for that.
Yeah, exactly. It's
like a virus. It's hijacked the whole laptop. The laptop is
exactly.
Yeah.
So your inhibition has gone. There was a guy called Phileas Fogg.
Phileas Fogg, yeah.
No, my
bad.
No, you're talking about some. You're talking about some traveller guy, right?
Yeah.
There was another one. There was another guy who he was working on a railway station, and he got impaled by a pole, and that took out his prefrontal cortex. Took it out. Okay. Because the prefrontal cortex, it executes, but it also inhibits, because it's the akal. The akal is there. Akal will say, that's a stupid thought. I'm not going to act on that.
Common sense. Just so that akal means common sense.
Common sense, yeah.
Common sense is right.
Yeah, exactly. Because your prefrontal cortex will say, eat chocolate and sleep with every woman you want. This is the human nature. But the prefrontal cortex says, no, I'm not. So
that's the fantasy part of the brain.
Yeah, exactly.
Chocolate, sleep with loads of women, fantasy, back of the brain,
back of the brain.
Prefrontal cortex saying, shut up, it's not going to happen.
Exactly.
Stop dreaming.
Because Allah does not hold this account. Allah says this
is what you consciously...
Yeah, because Allah says this is what will be held for account. This guy, I think it's Phileas Fogg, his name was, or something like that. It's similar. He got impaled, and the spear took out a bit of his prefrontal cortex, and he went. So he got impaled. He didn't die. He continued working. And true story. This is 200 years ago, and he just kept swearing, and he just kept being sexually inappropriate.
Right, apologies. We are back. I'm having memory technical issues. Obviously, we've got loads of information coming out, so we'll just keep going as long as we can. Right, so carry on at where we were with the brain, the prefrontal cortex, the weird brain, all the madness, and the guy, Phileas Fogg, he kept swearing once he lost the...
Yeah.
Yes.
So interesting story. In Victorian times, a guy, railway worker, was a good, diligent worker, and then he got into a freak accident whereby a pole impaled his brain, took out a bit of the prefrontal cortex on the way out, and he changed overnight. He changed into a very rude, obnoxious man. Injury changed him. Why did it change him? Because his frontal cortex, a part of it was excised. So his inhibition got lost.
Okay, yes, so that regulation of expression.
Yeah, exactly. So, we have thoughts all the time in our mind. We might even have bad thoughts or naughty thoughts or whatever. You don't act on them. You don't act on them.
Yeah, they're passing thoughts.
Yeah, they're passing thoughts. But when he lost that prefrontal cortex, a part of it at least.
So he literally spoke his mind.
He spoke his mind.
All the time.
He literally spoke his mind, yeah. Literally.
That's what it was.
That's what it was, yeah. And this what sometimes happens in schizophrenia.
Okay.
They just speak their mind, isn't it?
Right, okay.
They speak their mind. So this is, again, it's not to do with prefrontal cortex being removed. It's the regulation of, because they have
the ridiculous thoughts.
Yeah, exactly. And but also they have dopamine as well. Too much dopamine. To always firing.
Sorry, who has dopamine? The personality people.
Yeah,
with personality
no. Those with schizophrenia.
Right. Sorry, with schizophrenia. Okay.
Yeah. So it's too much dopamine. So they have a dopamine excess, and so they start gambling. And they start doing pleasurable things like, hypersexuality.
So they want to constantly feed
exactly.
heightened excitement level.
Yeah, and they have disinhibition at the same time. They start, being sexually lewd and start gambling so much money away because they don't have that inhibition. But this goes back because these are extreme disorders. Whereas with narcissism and...
Sorry, doctor, one second. So, going back to schizophrenia. So you got borderline personality disorder, overt and covert.
Yeah.
You had the narcissistic behavior, narcissistic personality disorder, overt and covert.
Yeah.
And you're saying, where does schizophrenia fit in? Say that, is that further up the chain as the most extreme?
Yeah, so schizophrenia it's actually a mental health disorder. It's a mental ailment, like depression, like anxiety, like PTSD, which actually is a good thing to go on to, PTSD. So you've got something called CPTSD, complex PTSD. This can emanate from childhood trauma.
Okay, so that goes back to the second generation trauma.
Yeah, exactly.
Or childhood trauma.
Childhood trauma. And let's not forget the trauma of being a second or third generation migrant in this country.
Yes.
That's a huge amount of baggage.
100%.
Huge amount of baggage.
Cross-cultural contamination.
Exactly, absolutely. So much baggage and trauma here. Still finding our feet in this country. That's why at the University of Masculinity, we advise a lot of brothers not to marry British Asian girls.
Okay.
It's just not worth it.
It's just too many paradoxes.
Yeah, it's just not worth it.
Where I've come together and that'll going to play out in your relationship.
Exactly. It's too much Bollywood complex. They're watching Bollywood. They think they star the show. And they're not even that pretty. They're like 3 out of 10, most of the girls. You can get a much better looking Latvian or Peruvian girl.
Sign me up, bro.
Bro, let's do it today.
Sign me up, bro.
Much better looking. Who'll give you peace. Who'll give you peace. And as a Muslim man, we have that leverage. We are allowed to marry Christian girls and Jewish girls. We have that leverage. So why are we playing with marbles when you can be playing with mountains?
Yes.
It's not. Some fruits are not worth the squeeze.
I agree. I think yes. Look, I think if you find a girl now from the same, say, cultural background, so Gujarati, Pakistani, Bangladeshi, she's reasonably practicing as good. And I said practicing in the heart, in the personal affairs, as well as the practical stuff, and who's just sensible, a nice personality all round. It's even saying it, I feel ridiculous. It's too much to ask. It's not going to happen. Yeah. It's a fantasy.
It won't happen. So to get a girl who's psychologically not damaged, she's
okay. So would you say then? Okay, now that you've touched on this, so these women that you're referring to from other countries and whatnot, would you say there's less chance of them having these disorders?
Massively, hugely.
But okay, so could someone not argue? Okay, so let's say if they're from Eastern Europe, they may have had a difficult background, cultural or trauma,
and then it's the same. But generally, they've had better because their dads are dads. They're masculine.
So their framework, the societal framework, is still there to regulate.
Exactly. Here, the mother wears the trousers.
Okay, so hold on. So let's go back to this now, then. Yeah. These disorders and dysregulation. Let's say the borderline personality disorder, overt and overt, and the narcissistic personality disorder, because there's variations of it. And like, for example, someone could have borderline personality disorder, which is extreme or mild, right? Yeah, different forms. Do all of these stem from what we just spoke about, the second generational trauma and the childhood, and maybe mum was just an overpowering character in the house? Do they stem back to this, the family unit?
100%. So that's why one of our vetting criteria is always speak about not just the family unit, but the family dynamics. Because on the surface,
everything's hunky-dory.
Yeah, exactly. You could say, oh, she's from a single parent family, but she's from this other girl's from a nuclear family, so therefore she's better. However, the single parent girl from the single parent family
Might be exposed to less trauma.
Exactly. And she could be speaking to her dad every day on the phone, have a great relationship with him. When he comes to see her, she respects him, and he's taught her good values of how to respect your husband when you get married. The nuclear family with the two parents, the man could be a complete spineless coward, and the mother could wear the trousers. So on the surface, it looks like she's from the unbroken home, and the other girl's from the broken home. Actually, the girl from the broken home with the one mother, she's been raised with much better values. It's not the structure; it's the dynamics. The dynamics, and that's why vetting.
Okay, the dynamics of the relationship.
Yes, so it's not who's in the house.
Okay, you understand. Let me try and take it back to from a layman's perspective. Both of these disorders that we're discussing, they're the ability to regulate emotion. Yeah. So that regulation, or what's the other term?
Switch.
The governor. Let's call it the governor, the fuel governor in the engine. It governs how much fuel needs to get into the engine. So they say the emotional governor in the brain, right? Yeah, that switch or that processor that regulates it. That is formed during childhood, depending on the emotions you were exposed to in the environment you were in. So both of these disorders relate back to, especially in a woman, because women, like I said, by their nature and fitra are more emotional. So their development as their brain, their computer is built around emotion and what emotion they were subjected to during that childhood and upbringing. So now when we take the factors in of first generation immigrants, they brought their culture with them in an environment with a different culture, the gender wars that are playing out in politics and households, it's the way society's headed. Add to that the social media giving you attention, like you said, go back to this analogy of your 3, say for argument's sake, but you're getting attention of a 10 on Instagram. Hence that is feeding into the emotional regulator again, especially the kids, say girls in their 20s now, so they grew up in social media more. All of these factors is what feeds into these disorders.
Absolutely. So it's just unhinged attention now with lack of attention. And when I say lack of attention,
as in the household.
Yeah, lack of emotional attention in the household, and then validation, which then positively reinforces attention-seeking behavior. She's understood now that the more drama she brings about,
attention.
Yeah, exactly. Attention.
So whether it's good attention or bad attention to the emotional regulator, it's still attention.
It's still attention.
Whether people are feeling sorry for you. So when they go around, okay, people with these these disorders, they go around playing the victim, because when you play the victim, even from say these school moms, they're like, oh, listen, is this how it is? And they're giving you some form of affection and attention.
Attention is like gold. And you're getting attention by constantly being the victim. And how do you snap out of this cycle of constant victimhood? It's that self-awareness that I won't always be the victim. There will be chances where I'm the victim, but there'll also be phases in my life where I'm the oppressor. Some women with this personality disorder will never ever be the oppressor. They will always be the victim.
Yes. This is the pattern I've seen many times. They are. Unfortunately, in some cases, they look like the perfect victim. So for example, if a guy was to play this disorder where he looks like the victim, it'd be much harder to pull off being a guy, because you don't get as much sympathy.
Exactly.
Straight up, even from other men. Yeah, that's just how it is. So when a woman, there's this disorder, it perfectly complements the female gender. Yeah,
exactly.
Because some of them, they look like the perfect butter wouldn't melt.
We've seen it last year, didn't we? With the famous trial of Johnny Depp and Amber Heard.
Yes.
Perfect, he was proven guilty before he was proven then innocent. Well, he was assumed guilty before innocent.
Okay, so if you look at Amber Heard, actually just a very good example that you brought up then, yeah? Amber Heard, because I watched a bit of the trial, some of the dramatics you saw and heard. Borderline personality disorder, mild or medium? Like from the outside, from what we saw.
We call that histrionic personality disorder, histrionic. And that's more dramatic. So she's an actress, isn't she?
Oh, of course. Okay.
So we call that histrionic personality disorder. And that's pretty obvious. What's more malicious is the borderline personality disorder, which is covert.
I agree. That is so destroying because you can never explain it. You can't articulate. For a person dealing with someone like that, they can't explain it. They can't understand it. They don't know how to articulate. And when you do articulate a specific situation that's played out, you look stupid. They're like, what, is that it? Is that your problem?
Exactly. So it's very hard to put your finger on it. You're just like, I know this woman is not normal, but I can't.
You can't. There is no way, and I understand the frustration, and they cannot get it out. So for those men, as we said before, get them in front of a specialist by hook or crook. Use emotion, do whatever you have to, play the game. Get them in front of a specialist, psychiatric specialist of some sort, ideally female, who can then potentially take steps towards helping. Those youngsters, again, go back to the vetting, because obviously
vetting
this vetting is very. I'm finding this vetting very tricky, because to draw these, from what I have understood now, is this: during this vetting process, and what you teach is basically you can't. Tactfully, especially if you want to say call it a blue ball syndrome, you want to get laid, bro. This ain't the way. You can't ask stuff like that. You ain't getting laid. We check, please, yeah. So we got to do it like, say, from a sort of man's perspective of how men operate. So you have to just probe and gauge about how like her existing relations with mom, dad, brother. So the way I'm looking at this from a layman, sort of just an average Joe perspective. So like when you go out with a girl, you know, over months you talk on the phone, you get to know her. So the key thing you're trying to get to know is, what is it when she opens up to you fully, as in when she talks, oh yeah, you know what, my dad was always a bit funny with me. My dad was never at home. Or he was always busy working, or he cares more about money, or my mum favoured my sister over me. So you want to get to these. So put it into just layman's terms. During the vetting process, these are the conversations you want to get to.
Yes.
So to find out, because those relationships will deter how emotionally developed she is and how much trauma she's carrying.
Exactly.
Right, okay.
Exactly. And you don't want to play superhero in marriage. You want to be her husband, not her savior.
Yeah, this is what I've said. You're not her social worker.
Yeah.
The problem is, I find with these, the pattern that I've noticed with these disorders is, even the ones with the disorder, they looking to get into the marriage, and it's his responsibility somehow to, if they have any concept of I've got an issue, and this is what I've said, in a marriage, you're looking for companionship. You're not, and this goes for men or women, you're not each other's social workers or psychologists or doctors. You're looking first and foremost companionship. If you don't have that, listen, you can't do any of those other things. If you have that, you can do all the other things.
I wanted to say, and brothers, vetting is so important, because you are competing against 20, 25 or 30 years of her upbringing.
Yes.
So make sure that is on your side, that is on your favor, that is, that is favorable to you. So you could either have 20, 25, 30 years of bad upbringing, or the same amount of time good upbringing. So vetting is important, because you can't undo all that trauma in the first few months or even years of marriage. She has to be willing and intentional about seeking help and actually having counseling and therapy beforehand, and then you can do it as a couple as well. But certainly she needs to get her demons off her chest and out into the clinic table with a qualified psychotherapist.